Hi, my name is Jessica Scoggin. I'm the foundation manager here at Arbor Health. It's a non-for-profit organization where we help to raise money for needs for the hospital and the Employee Scholarship Fund. And we do that through people in the community. You know, one thing we have is the gift shop, and a lot of people know about the gift shop because it's really cool. We do events and the auctions, corks and caps. Those scholarships benefit everyone in the community because at some point, you're going to need to use our hospital, and those employees that have gotten those scholarships are people that are going to help serve you. So it all comes back around, and we all benefit from that.
My name is Olivia Wilbur. I've been an EMT I retired this year, but I was an EMT for 14 years, and we came through working at the ER. And when we had my son Oliver, about 9 months in, we realized he needed more therapy than what the state could offer. And so we tried Edwin and their department, and they've been amazing. And we started out with water therapy. We came once a week for that. Realized speech needed to happen, and we weren't getting enough services there from the state. So we came here, and they hooked us up with a wonderful speech therapist. She helped us get a speech device. So at 3.5, Oliver is learning how to communicate using that. And we started physical therapy with Amy, she's amazing. We started her 1.5 years as well, and I can honestly say they are the reason why Oliver has improved so much. We are 5 minutes away from the hospital. If we were to get services through anybody else, through the state, they wanted us to drive to Onalaska every day, and that was a 20-minute drive. That is really hard on us. The other option would have been an hour-long drive, and there was just no way we could have done that to get him the services he needed. We didn't get school services from the state until he turned 3, so for the first 2 years of his life, he had therapy through the hospital, was his main provider. There are a lot more kids. I've definitely done a lot more reaching out. I'm like, you guys, I get it. When you get offered by the state one 30-minute visit every 2 weeks, 3 weeks, and it's via Zoom because it got canceled, you can't do it. The hospital here, they kept us through all of COVID. Not many people will work with Oliver just because he's peds and it's very, very new. It's specialized and it's something that the hospital is growing, but they definitely need that funding and the money to help for the training. I know Amy has gotten some. When Christina was here, she'd gotten some. Lindsay actually works with peds, so that was kind of a cool gain for us.
My name is Eloise Pugh, and I was born here in Morton at this hospital, but it was not this hospital. It has grown a lot. I've been hospitalized here quite a few times in the last few years. I'm always grateful for the care that I've gotten. The nursing care is absolutely wonderful.
My name is Megan Christensen, and I'm a registered nurse here at Arbor Health. I've been here for 14 years. I did receive a scholarship through Arbor Health. I went back and got my BSN last year, and basically every quarter they contributed money that, basically made me able to complete that program. My whole career has been here at Arbor Health. I started here as a new graduate, and I loved it so much that I have stuck with them, and basically anytime I've needed to take extra classes or anything, they have provided me the opportunity with a scholarship, just like going and getting like a certification.
My name's Debbie Cole, and I'm a physical therapy assistant, and I help with the rehab department and helping people heal themselves and get better and get back to their normal lives. I was offered the opportunity through my supervisor to get my what they call the CAPC, which is a Certified Aquatic Physical Therapy Credential Certification. It gives me the tools to be able to work with people in the pool. There's a lot of different techniques that are specialized, such as what we call Halliwick. It gives me the opportunity to work with a lot of people who have strokes and neurological problems that can't really work on land. And it opens up a big door for our community because this really is not offered in a lot of places in the state of Washington. And by getting the certification right here in our own small town, it gives us a chance to be able to work with people without them having to go far away. It just helps us to reach our goals, and we are a small town, and the more people in our area that we can teach and give them the opportunities, I think is just really big and real important.